I'm Johnnie Wright Jr., and I'm a board-certified urogynecologist at Prisma Health. I did my undergraduate studies at the Citadel and graduated in '93 and moved right down the street to the Medical University of South Carolina for medical school. Did residency with the military in San Antonio, Texas, and additional training in urogynecology at Walter Reed Army Medical Center in the National Capital Region. And it kind of moved around with 20 plus years with the military before transitioning to a small practice in North Carolina for a brief time, and then the University of Kentucky for the last 3.5, 4 years. So urogynecologists are providers who have specialty training in addressing complex pelvic floor disorders for women. There are two ways to get to board certification in urogynecology. You could take the route that I did and do general obstetrics and gynecology residency, and then additional 3 to 4 years of training, depending on the program. And then our colleagues who have residency training in urology can also attend additional training for 1 to 2 years to obtain the board certification. So it's a dual kind of avenue to get to urogynecology, but we all focus on the female pelvic floor and complex pelvic floor disorders. Most patients present with either prolapse, which is relaxation of the pelvic floor, and so there's herniation of organs, which can be uterus and cervix for gynecology, sometimes a rectum, and sometimes a bladder. And then a significant portion of those patients will also present with urinary incontinence, and there are a number of different subtypes of urinary incontinence, but we welcome the opportunity to see you to address all of them. I developed an interest in just complex pelvic floor disorders while in residency. I made the decision to do obstetrics and gynecology because I had this desire early on to learn how to take care of women from birth to death, and that I was going to come back to a small town here in the Carolinas and take care of women. And over time, that changed as the landscape changed, and I thoroughly enjoyed education and was highly encouraged to seek a fellowship. I thoroughly enjoyed operating as well, and of all the subspecialties within gynecology, urogynecology was a good fit. And so with the combination of just that love for teaching and the complex surgery and the opportunity to build a relationship with the patient, urogynecology has served me well. A lot of our current complex surgical interventions, we leverage the Da Vinci robot for mainly prolapse procedures, and sacrocolpopexy is definitely one of the procedures that I would offer here at Prisma Health. But I feel extremely blessed in that I've had the opportunity to mature with several different approaches, vaginal, abdominal, laparoscopic, as well as robotic. It's just from a timing and training, I've had the opportunity to train with some of the best pelvic surgeons in our subspecialty over my career. And again, I welcome the opportunity to help you with your individual challenge for your pelvic floor. It really starts with a simple conversation, right? And that simple conversation, I like to tell everyone that we will get simple and approach things that hopefully will address what your major concerns are before we get super complicated. And so I spend a significant amount of time at that initial encounter just having a conversation, trying to help the patient share with me what activities of daily living have been altered because of the current pelvic floor condition. And then through a combination of verbal and some handout and some digital means, I share what's the latest and the greatest within the subspecialty, right? We try to stay up on the latest treatment interventions that have good evidence. And if we can't provide those, then there are a couple of places where I could probably recommend from a research perspective that they could participate in a research study that would help advance the treatments around said pelvic floor condition. When I'm not practicing medicine, I like most things outside, right? I'm excited to get back to the Carolinas just for the idea of being able to hike and fish almost year round, right? So, and I do enjoy spending time, with family This has afforded me the opportunity to get back closer to home with aging parents and aging family members. I sincerely appreciated their support with me moving here, there, and everywhere over the last 20 plus years. So it's exciting to be within a couple hours drive from home, to get down, get back, have dinner with your parents and the like. If you'd like to make an appointment with me, please have your primary care provider send a referral to see me or reach out to me at the number on the screen.